Hey, welcome to episode number 40 of the Go-To Physio Podcast. And this is episode 6 of season 3 of the podcast. And in today's show, we're going to be talking about physical and emotional stressors and how they can be massive tripwires to you helping your patients keep progressing. Hey, welcome to the Go-To Physio Podcast. My name is Dave O'Sullivan, and in this podcast, my aim is to give you 15 years of my experience in professional sport and private practice and share that knowledge so that you can get real-world results with your complex patients who have failed traditional approaches. I hope you enjoy the show. For me, the stress is everything, okay, for a patient. Now, when I look at a patient, essentially, I look at the iceberg effect, okay? So we've got this person, and I imagine him as an iceberg, and above the water is the bit of the iceberg you can see, and that's the conscious person, and that's what they're telling me they're feeling, and the problem, and all of this stuff, okay? But really what I'm working with, and what I'm really interested in, is what's happening below the water, and that's the subconscious, okay? And a lot of the times what I'm looking at there is I'm looking at, okay, how has the nervous system reacted to this stress? Now, the key thing that I talk about in Happy Progressing Patients is page 56. And I talk about the stress and reactions to stress. So I say here, on my crusade to find the magic bullet, I'd taken a lot of breathing courses and I'd learned about various other techniques that looked at the diaphragm, that I mistakenly thought the diaphragm was the problem, okay? Now, this is something I want to clarify today because I've got a PDF and you wouldn't believe about the negative comments on Facebook. It's absolutely astounding, okay? Where people, they see something, they get an emotional reaction, they jump in with some negative comment. Now, ironically, the whole point of putting the diaphragm PDF together was actually to help you understand why mobilizing the diaphragm can actually have a profound effect on a lot of things. And we're going to talk a lot about that in today's episode, okay? Because the diaphragm is just like another muscle, okay? If you had somebody with knee pain and they come in and they had really poor range of motion, okay, they couldn't really lengthen the quads through full range of motion, then probably one of your treatment strategies for that patient is let's restore range of motion, let's increase load tolerance. Why does that have to be different for the diaphragm? The second we mention the diaphragm, because people aren't 100% understanding it, okay, or understanding the full picture, their guard goes up because they don't really understand it, okay? The diaphragm's like any other muscle, okay? It needs to go through full range of motion. When you get that diaphragm to go through full range of motion, you help the rib cage go through full range of motion. Just like when you help the quads go through full range of motion, you help the knee joint flex. Okay? It's as simple as that. Now, why the diaphragm's interesting is because the diaphragm can react to emotional stress. Okay? And that's where it becomes interesting because it can have a knock-on effect throughout the rest of the body. So my biggest mistake when I started out was thinking it was all about the diaphragm. I'd taken a lot of courses in various breathing courses, and the one thing I will say is a lot of the courses I've taken, I've done the work, okay? I've done PRI courses, I've paid a lot of money to a PRI, one of the top PRI guys in the world, because I wanted to understand it. I don't necessarily agree with the approach in all honesty, okay? I think there's a lot easier ways to work, okay? And some of the stuff, maybe not, okay? I've done Buteyko breathing, okay? I've spent 6 weeks with a Buteyko instructor going through it myself, okay, to really understand it. The literature is a little bit sketchy with Buteyko, with some of the stuff that they're talking about, but I can see why a lot of the stuff actually would help somebody. I can see why a lot of the stuff with the PRI and other breathing courses I've taken would help people. And I think that's the real importance. Now, again, just for the keyboard warrior, I'm not saying PRI is just a breathing course, okay? But there's a lot of good stuff there from all of these courses. Knowledge is in power, as I said before, unless we can take all that knowledge and apply it. And that's where really I just want a simple, structured, step-by-step system that can consistently get results, okay? Now, when we look at stress, and we can start to see, my biggest mistake was thinking that, as I said before, the diaphragm was the cause of problems. And what I realized is the diaphragm is just reacting. And that's why I've got a little bit of an issue, okay, with some of these techniques where if somebody fails a test, it's just right, give them this exercise and that restores range of motion, okay? We actually know from the literature that just improving clinical outcomes like increased range of motion, it's not enough to guarantee patient satisfaction in private practice, Okay, I think the literature is in private practice in that. Okay, clinical outcomes alone are not enough to have patients satisfied. Okay, that's in the literature. So that's where we have to solve patients' problems. And we have to understand that actually, it's all well and good increasing a straight leg raise or increasing shoulder range of motion. But what happens when the person steps outside into the real world again? There's a lot of stress, a lot of stimulus. And that's where this is what I'm talking about on page 46 of Happy Progressing Patients. We have to understand what caused the diaphragm to react in the first place, okay? Cause and effect. The diaphragm losing range of motion, it's very much an effect, just like the quad loses range of motion. And that's where you have to look at the person first and the person's story to start to get the clues and make a working hypothesis and clinically reason why that might happen. So in this, I talked about an increased breathing rate. Okay, actually, I'll go here. The stressor was specific to the first person in front of me. It finally clicked that the stress can come in many forms, but emotional and physical. The respiratory system can become sensitized just like the musculoskeletal system. Stress can increase the heart rate, which can also affect the breathing rate and breathing depth. And that's where then you're going to get a second order consequence of the diaphragm. So again, episode 4, I talk about second order consequences. A lot of the time the stress is causing a second order consequence of the diaphragm losing its range of motion and the respiratory system becoming sensitized. Okay, so an increased breathing rate usually means a decreased exhalation time, which means a reduction in the diaphragm's ability to lengthen during the exhalation. Okay, so again, a lot of people, and I'm going to exaggerate this just for teaching purposes. If you think of somebody having a panic attack, we're getting a lot of inhalation, okay, which is a lot of shortening of the diaphragm. Okay, think of that as a knee extension. Okay, and we're not getting a whole lot of exhalation, which is knee flexion. Okay, in terms of the quad length. Okay, so again, the diaphragm lengthens when we exhale into a dome shape, and it shortens when we inhale. So people who don't exhale, okay, and again, we can see from the literature, exhale is pushing us more into rest and digest. Inhale is more fight or flight, okay? Inhale, exhale. The longer we can exhale, the more relaxed we are. Inhale, exhale, relax, okay? So the exhalation is going to be a key tool to help us actually get patients to relax. Now, another thing I also say, slightly going off topic, is it's a lot harder to get somebody to relax than it is to tense, okay? So said another way, it's a lot easier to get someone to inhale than it is to get them to exhale for a longer time than exhaling, okay? So this also means a reduced ability to access rest and digest. So if we can't exhale for a long time, we can't lengthen the quads, we also can't access rest and digest for a little bit longer. Now, for a lot of patients with persistent pain, anybody, to be honest, with pain, getting them to access rest and digest a little bit more, it's going to help them sleep better. It's going to help chill them out a little bit, which is probably then also going to help their pain experience. Okay, certainly from my experience. Okay, so getting people into rest and digest, you're going to get a lot of big benefits to that, not just on the physical side of it. Okay, so as I said, think about somebody having that panic attack and they lose the ability to lengthen the diaphragm. So as I said, this is probably happening over a prolonged period. And then, as I said, the other second order consequence is the mind tends to get busy, okay? So again, we want variability. We want the heart rate variability. We want breathing variability. When we increase our exhalation, we drive more variability, okay? We also spend longer in exhalation. We spend longer with the heart rate going down. So the heart rate decreases a little bit when we exhale, okay, from the literature. So again, that's going to help us decrease the heart rate, probably decrease blood pressure also. So the prolonged exhalation, it not only lengthens the diaphragm, gives the diaphragm an opportunity to lengthen, but it pushes us into rest and digest. It gives us an opportunity to have variability within our breathing as well. So it's not just about movement variability, breathing variability, heart rate variability. You'll start to see it as one system. It likes variability. It likes that change, okay? So when we start to think about the stressors, that's where now a real key question in the subjective assessment and helping you actually apply this stuff in the real world is that I like to ask is, what are the most stressful times of your day, okay? But also when we look at their timeline of previous injuries, we want to also note any times of key stress in their life. So again, have they lost a loved one? Have they had any life-changing events? Okay, stuff like that, traumatic events, all of those kind of things could be clues as to why the nervous system has adapted like this now. And then, as I said, then you see somebody going to touch the toes, and they don't have a whole lot of movement through their rib cage. They can't access full range of movement through their rib cage. Said another way, they can't lengthen their diaphragm fully, just like knee flexion. They may be restricted with that. You find out the stressors to that. The great thing about the breathing exercises is that's a really good tool to restore that movement through the diaphragm, but also help push us into rest and digest. And as Carl Morris, a sports psychologist I was lucky enough to work with over the years, especially at Huddersfield Giants, he always said to me, the beauty of focusing on the breath is you're focusing on the present moment. So I'll use the breath work as a trigger a lot of the times to help a patient get back into the present moment if they're starting to catastrophize a little bit, or starting to get their thoughts on negative aspects of their body, which then creates an emotion, which then creates a behavior. So it's a really good tool to do that as well. So we've talked a lot about there, the diaphragm's ability to lengthen is important to also help us access rest and digest. Now, how does that translate also to a physical side of the coin, so to speak? So the other really important thing to understand about that is the more we lengthen the diaphragm, the more rib cage depression we get. Okay, the obliques can work, okay, really well. That's also usually going to couple with a posterior pelvic tilt to the pelvis. Okay, when we inhale or when we elevate, protract the rib cage, okay, that's usually going to coincide with an anterior tilt to the pelvis. So very often you might have somebody who comes in and they'll be kind of highly stressed. They might say, "Oh, my hamstrings always feel tight." Okay. Well, is the hamstrings first order consequence or is it second order consequence? So very often with that type of patient, I'll focus a lot more on actually mobilizing the rib cage, restoring the ability of that diaphragm to lengthen, and then very often that hamstring sensation tends to settle down. Because again, if we can't access full range of motion through the diaphragm, we can't bring that rib cage through a full range of motion, then very often the hamstrings, if we have an anterior pelvic tilt, for example, and they struggle to access full range of motion and posterior pelvic tilt, then very often they're going to really struggle to shut down the receptors, because the receptors in the skin, the fascia, they're all going to be stimulated when we stretch or when we lengthen. Okay, so again, if you go into anterior pelvic tilt, you're going to stretch, you're going to stimulate the receptors around the hamstring. So it might necessarily be the muscle, it could very much be the skin, the fascia. Okay, we're stimulating those tissues. That's sending a signal up to the nervous system or into the spinal cord, then that can go up into the higher centers and we can have a conscious experience. Okay, now ironically, the hamstrings will feel tight, but they're actually lengthening as such. Okay, because again, if these receptors are being stimulated, then we know that they're being stretched. So the last thing you want to do is stretch the hamstrings more in that scenario. Okay, now it might feel nice short term, but then what you'll find usually from my experience is 15, 20 minutes later, even up to an hour, the hamstrings are tight again. Whereas if we address that mobility issue through the rib cage, then very often they'll dampen down quite quickly. Okay, so again, that's an example of a second order consequence. Whereas if we do something, we get a good second order consequence where the hamstrings might actually dampen down a little bit. Now, the big thing that I want you to really understand here, and this is the mistake I made, is it's not the diaphragm's fault. We have to go one step further and ask ourselves, why did that diaphragm lose range of motion in the first place? And that's very often where we have to look at the person as a whole and go, okay, it's not just physical stresses, but also environmental factors. So again, you look at Louis Gifford's mature organism model, and on that, he's got a beautiful diagram where he is the spinal cord, the brain, and then he's got like an arrow, and it's got physical factors out, environmental factors also. Okay, so you got all these stimulus coming towards the nervous system. Okay, and the environment is one of those that he mentions on the mature organism model, and that's where the environment of work stress, what's going on at home, all of these things can create a reaction and a behavioral change, which then can actually result in all of these things happening. And that's where, unfortunately, it's not just as simple as giving a few breathing exercises. And that's why the first pillar of my 8 pillars of the Go-To Physio, subjective assessment, understanding your patient's story. That's why it's so important. Because if we want to give the patient a breathing exercise, we give them 3 sets of 10, or they blow up a balloon, or they do whatever to restore mobility through the rib cage, but then they go back into the real world and we haven't identified the true stressors, then very often they're just going to go back, from my experience, into the usual habits. Whereas if we identify where is it an environmental stressor, what can we do to break these patterns? So that's where I might give them some breathing exercises, either before they go into the environment, okay, or while they're in the environment, just to try and break these habits that they're doing. Okay, so that's an example of your emotional stressors. Obviously, your physical stressors, we talked a lot about this in the previous episode around motor adaptation literature. Okay, so again, we can look at emotional stressors, but also I would see previous injuries as physical stressors. I think, I can't remember who said it, and I want to give him credit, but I can't think of his name at the moment. Said, an injury, it might have been Bill Knowles, an ACL injury, it's not just an ACL injury, it's an injury to the central nervous system as well. And then somebody else said it, I can't think of the name, and it's an insult to the nervous system. An injury is not just a physical injury, it's an insult to the nervous system as well. Okay, and that's where these physical stressors, then we can start to see, okay, there's an injury. We can see from the literature how the nervous system reacts. It tends to avoid loading the area. Think of rolling an ankle. You avoid loading the big toe for a few days. You allow it to heal. Then again, we see in some of the other literature that actually, up to a year later, as I said, I know it's an old paper now that I'm quoting, Bullock-Saxon, that you can have altered muscle activation at the hip. Okay, so again, there's all sorts of things that can happen as a result of previous injuries. And from my experience and my approach is very much, okay, well, actually, let's just get the body back happy to tolerate load through these areas. And that's one of the key principles that I'll talk to you about in my low-level rehab approach. Is very often my approach with those patients is find what's not doing its job and then put them in positions where the nervous system has no choice but to tolerate load, in the hope then that we can update the belief system. Okay, so that's all I've got for you this week. Okay, from a practical application point of view, if you do use breathing exercises and you're aware of the rib cage and the pelvis reactions and all of those things, I want you to go one step further this week, and I want you to ask and get really clear on a subjective assessment is what's the most stressful time of the day for the patient, but also what's in their story that may have caused these reactions. So rather than just going and prescribing breathing exercises, start to make this specific to the patient. Actually think about, okay, in their day, where can I put my breathing exercises in to get the most bang for the buck? How can I change these behaviors, these movement habits and movement behaviors? And I like using the word habit rather than movement patterns, okay? Because I think it gives a more realistic focus for you as a therapist, but also for the patient. Actually, it takes a little bit of time and practice to change habits. Patients appreciate that, whereas if you talk about movement patterns, then I don't think they resonate as well with that, whereas a lot of patients will resonate with the word habit, okay? So just another little tip for you there, okay? That's it for this week, okay? I'm rambling on a little bit. As always, if you enjoyed the show, I don't use adverts or anything like that. Please share the show with somebody who you think would benefit from it, whether it's another therapist or somebody like that. If you really enjoyed the show and you got value from it, please leave a review as well, okay, either on iTunes, Spotify, whatever it is, and that just helps us get it in front of more people also, okay? If you've got questions you want answered on the show, head to thegotophysio.com/questions, okay? If you've got any interest in picking up the book, if you haven't done so already, thegotophysio.com/book, okay? Our special project that's about to be launched, okay, for people who aren't quite ready for the mentorship, thegotophysio.com/members. Or if you want to get this sorted in the most simple and direct path, you want to put it all to bed, all the mistakes and stress, and you want to get a structured step-by-step system to confidently keep any patient happy and progressing, then head over to thegotophysio.com/mentorship. That's the flagship program. That's where I work more closely with therapists. We do it over the course of 8 to 12 weeks, and we transform your clarity, your confidence, your patient retention. Most importantly, we do all of it by getting great results with your patients. Okay, that's it for me for this week. I hope you have a great week. Let's get out there. Let's start looking at people rather than pain. Let's solve the biggest problems for patients that the pain is causing them. Let's make life-changing impacts on our patients' lives. All right, so that's it this week. See you next week.